Hey guys, Dr. James here, just wanting to give you a quick update on a patient of ours, Neville, who is a little dachshund who has actually had bilateral shoulder arthrodesis, and just want to kind of show you how he's functioning and moving around, and just going to go through those x-rays, post-op x-rays very quickly. So this is Neville, he's about 12 weeks out, and Jeff is just going to walk him forwards for me. So you can see how well he's walking. He had a really severe bilateral glenoid dysplasia and was really badly affected by this. So we did his first surgery initially probably a year ago. Initially when we did that, we had some complications post-op where one of the plates broke. And so the x-rays that we've got, just to kind of show the extent of what we've done, is we've got a 2.7 and 2.0 SOP plate. And when I did this surgery initially, on the first side where the plate broke, I'd used just a single 2.7 plate, and that actually broke the plate. So when we revised it on the first side, which was this one down here, we actually put 2 plates on, which is not uncommon for these shoulder arthrodeses. So he's doing really well. He's in for another x-ray today just because there's a little bit of lucency here at the front of the joint space that we want to keep a track of. But ultimately, we're really happy with how he's going. You can see the function that he's got is really excellent. So, yeah, basically, shoulder arthrodesis, it's a great option as a salvage for severe shoulder lameness. I think he's probably the smallest dog I've done a shoulder arthrodesis on, and having done that bilaterally, yeah, I think that's a really great outcome. So, hope you guys all have a great day, and see you later.